Hi, my name is Jorge Espinosa. My topic about is pituitary hyperplasia from primary hypothyroidism. Eh, Definition. Pituitary hyperplasia is a relatively common condition that occurs in both psychological and pathological state. Pregnancy is the most common condition associated with psychological pituitary enlargement associated primarily with lactothrombosis hyperplasia. Incommonly present but remains largely in, in the diagnosed in primary hypothyroidism.
Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be talking about hypothyroidism. You can find written notes on this topic at ZeroToFinals.com/hypothyroidism or in the endocrinology section of the Zero to Finals medicine book. Let's jump straight in. Hypothyroidism is the term used to describe inadequate output of thyroid hormones by the thyroid gland. There's a few different causes. The most common cause of hypothyroidism in the developed world is Hashimoto's thyroiditis, and this is caused by autoimmune inflammation of the thyroid gland, so the body's immune system attacking the thyroid gland. It's associated with antithyroid peroxidase or anti-TPO antibodies, and also with antithyroglobulin antibodies. Initially, it causes a bit of a goiter, after which there's atrophy of the thyroid gland as the hypothyroidism sets in. Iodine deficiency is the most common cause of hypothyroidism in the developing world, and this is because iodine is essential for the production of thyroid hormones. Iodine is added to foods like table salt to prevent iodine deficiency and to prevent hypothyroidism. Hypothyroidism can also occur as a result of treatment for hyperthyroidism. So all the treatments for hypothyroidism have the potential to overshoot and cause hypothyroidism. So these are treatments like carbimazole, propylthiouracil, radioactive iodine, and of course thyroid surgery. There are also medications that can cause hypothyroidism. Lithium inhibits the production of thyroid hormones in the thyroid gland, and so can cause a goiter and hypothyroidism. Amiodarone interferes with the thyroid hormone production and metabolism, and usually it causes a hypothyroidism, but it can also cause a thyrotoxicosis. There's also secondary causes of hypothyroidism, or central causes, and this is where the pituitary gland is failing to produce enough TSH. And this is often associated with a lack of other pituitary hormones as well, such as ACTH. And this is called hypopituitarism, and it has quite a few different causes. And these causes can be tumours of the pituitary gland, infections in that area, vascular pathology, such as something called Sheehan syndrome, where you get pituitary necrosis after massive blood loss during childbirth, and radiation therapy to the pituitary gland. So how do patients with hypothyroidism present? Well, they can present with weight
Application medical. Pronounced and severe traumatic hypothyroidism was first recognized from the autopsy of a creatine pituitary enlargement secondary to primary hypothyroidism was first reported by Liexing in 1851 and from to produce no simple my in expansion unless there was compression of the open chain.
The most common pituitary disease is indeed pituitary tumors. And it turns out that about 1 in 10 people in the population have a small pituitary tumor. And these are called incidentalomas because usually they're found by accident. So somebody comes in and needs a head scan because they're having a headache, or maybe they had a motor vehicle accident, and you find a tiny tumor in the pituitary. Most of these tumors are clinically insignificant. They do not produce hormone, nor do they knock out hormone production. The tumors that we worry about in the pituitary gland are tumors that actually overproduce hormone, and those include tumors that produce prolactin, known as prolactinomas, which are classically the only hormone-producing tumor that can be treated with medication alone. The other hormone-producing tumors, including growth hormone-producing tumors causing acromegaly and ACTH-producing tumors causing Cushing syndromes, are treated surgically initially. They may require further treatment down the road, but the treatment of choice is surgery. In addition, the size of the tumor is critically important. Tumors that are less than a centimeter in size, unless they are producing hormone, can typically be followed and monitored. Tumors that are greater than a centimeter size are more concerning, especially if you're more than 1.5 by 1.5 centimeters in size. And those tumors, whether they produce hormone or not, oftentimes have to be surgically resected because they can cause problems and abnormalities by the size alone. Pituitary tumors are classically small in size, but some tumors, especially tumors that do not produce hormone, can be silent for years and therefore can present as very large tumors. And it's interesting that in the pituitary, we consider a large tumor to be greater than 1 centimeter. So tumors that are more than 1.5 by 1.5 centimeters get much more attention even if they're not producing hormone. And we certainly can see tumors that are 2 to 3 centimeters in size. And we are much more concerned about those tumors causing compression of other tissue, and sometimes bleeding can occur in those tumors and cause something called pituitary apoplexy, which is a medical emergency where pituitary function is lost. So the size of the tumor is critical. The incidence of pituitary tumors in the population that have to be surgically removed is about 35 per million per year. And that includes tumors that are large and then tumors that overproduce hormones.
Pros and cons. Pros. Easily resolved with thyroid hormone replacement therapy and correct the amenorrhea, galactorrhea syndrome along with the regression of the pituitary tumor over 8 months. Cons. They are often diagnosed late when the tumor has increasing in size and cause local compression. Only 38% present with a shield complying surgery of hypothyroidism on initial presentation. Usual application in Ecuador. The The incidence of pituitary hyperplasia in primary hypothyroidism has not been clearly identified, but recent literature suggests that it might be more common than previously accepted. In Ecuador has a high prevalence of hypothyroidism. Conclusion: the incidence of pituitary hyperplasia in primary hypothyroidism has not been clearly identified. By recent literature suggests has in might be more common than previously accepted. Also, it's very important to count as hypothyroidism is a risk factor of hyperplasia to have a beating and further diagnosis. Thank you.